Assalamu alaikum wa rahmatullah. The article of this week is titled Ozone and Laser Effects on Dentin Hypersensitivity Treatment, a randomized clinical study. It was done in 2024 by an Italian group and published in the Journal of Endodontics. So, the dentin hypersensitivity is a condition characterized by short and acute pain arising from the dentin in response to osmotic, tactile, evaporative, thermal, and chemical stimuli that cannot be attributed to any other dental pathology, and it's most commonly observed in patients between the ages 20s and 30s. Although the literature presents studies supporting the effectiveness of laser diode and ozone treatment in the treating of dentin hypersensitivity, there are no clinical trials comparing these two procedures. So the aim of this study is to evaluate the effectiveness of ozone gas and diode laser treatments in alleviating dentin hypersensitivity immediately after treatment, as well as after 3 and 6 months of follow-up. Moving on to the methodology, they have included patients who were 18 to 70 years old with a chief complaint of dentin hypersensitivity for more than 1 year, stimulated dentin hypersensitivity more than a 6 on VASA scale, and also that affected 3 non-adjacent teeth of different mouth semi-arches. And they have excluded patients who had periodontal surgery or desensitizing treatment in the last 3 months, pregnancy or breastfeeding, and also teeth with caries, restoration, pulpitis, anomalies, fracture, or occlusal issues. 132 teeth from 44 patients with moderate dentin hypersensitivity were randomized into 3 groups according to the split mouth design. In the diode laser group, the operator irradiated the superficial dentin exposed with a 20 seconds interval. In the ozone group, the operator applied a high dose of ozone for 30 seconds using a silicone cup, and in the placebo group, no therapy was applied. The dentin sensitivity level was evaluated upon enrollment, immediately after treatment, 3 months post-treatment, and 6 months post-treatment. With a cold air blast challenge and tactile stimuli, the pain severity was quantified according to the visual analog scale. For the results, in both ozone gas and diode laser groups, dentin hypersensitivity showed an immediate reduction after treatment and continued to decrease after 3 and 6 months, effectively addressing the chief complaint. And also there was no significant difference in pain reduction in the placebo group. A complete resolution of hypersensitivity was observed in 2 teeth treated with ozone and 1 tooth treated with diode laser after 6 months. The mean percentage of pain reduction was 57.5% in the laser group and 68% in the ozone group, although there was no significant difference in pain reduction between the 2 groups immediately after treatment. After 6 months from therapy, sensitivity values in the teeth treated with ozone gas remained statistically lower than those treated with diode lasers. In conclusion, they demonstrated effectiveness of ozone gas therapy and diode laser therapy not only immediately after application but also over a 6 months period, suggests that these treatments could serve as a viable long-term solution for patients suffering from this condition. Moreover, the superior effectiveness of ozone gas treatment after 6 months indicates that this specific therapy might offer prolonged benefits, making it an especially valuable tool in the management of dental hypersensitivity.